Perfect. Believe I started the recording.
Okay. Awesome.
Perfect.
So we're starting with explaining sternal precautions to my lovely assistant over here.
Yeah, that works.
This is my husband, Jason.
Hello.
My dog, Arlo, who's assisting.
Cute. Yeah, so if you could just demonstrate how you would educate like a patient on the sternal precautions.
Okay, and I have to do like the whole thing, like introduce myself and, or can I just go ahead and say, we're going to talk about our sternal precautions today? Is there, do you have a
whatever
preference?
feels comfortable to you. It doesn't matter.
Nothing feels comfortable. Okay. All right, here we go. Jason, how are you today? I'm hanging in there. My name is Jenny Straka. I'm going to be your occupational therapy assistant student, and we're going to work today on reminding you about your sternal precautions after your coronary bypass artery graft surgery. You might have heard of it referred to by your surgeon as a CABG or by your doctor. Is that correct? Awesome. And then have they gone over the sternal precautions that you're supposed to be maintaining?
Briefly, but it's foggy.
Briefly, but it's foggy. Great. We're going to work on them today and we're going to practice. And you should be ready to rock by the time we're done here. Sound good?
Yep.
Awesome. First and foremost, you just had a major open heart surgery. So all of your, so your incision is healing. We want to protect your chest. We want to protect that incision. We want to minimally use your pectoral muscles just to encourage healing and prevent infection or further injury. So all of these sternal precautions are going to help us do that and maintain proper body mechanics in order to keep you recovering smoothly as possible. Okay. I see that they gave you your heart pillow. This is going to be one of your best friends when you are maneuvering in the bed. But first, some things that we're not supposed to do to maintain these sternal precautions is, let's see, you're not going to lift your arms up over your head. We're not going to lift them out to the side, and we're not going to lift them behind you, as well as push up, do any weight bearing pushing up, like getting off the bed or getting off of a chair. Okay. A great way to remember that is move in the tube. I know I just told you a lot of no's. You're not supposed to do all these things. So if you remember moving the tube, you'll be good to go. We're going to imagine an imaginary tube around your sternum, around your upper arms. And any of your movements you can do as long as you're keeping your arms your upper arms with your chest and move in the tube. Sound good?
That's great advice.
Awesome. Let's see. There is also this I introduced this one, your heart pillow. If you're going to cough or sneeze, best thing to do is hold this to your chest and give a little pressure. That way it'll reduce pain and help protect your incision. Okay. It for sternal precautions. Oh, just kidding. Two more. If you are lifting anything, keep it between 5 and 10 pounds. And if you are going to lift anything or do things such as open the door, make sure you're doing both arms together. We're going to avoid any movement from side to side or with one arm, no twisting or deep bending also.
Okay.
Right. Great.
Perfect. That was great.
Cool. And our next one is
so teaching upper body dressing while adhering to sternal precautions.
Upper body dressing. So can he just sit up or should I have him roll and sit up?
You can just sit up. That's fine.
Come on.
Unless you want to practice the log roll. Let's see.
Can we do the log roll first just to and that way I can practice it?
Go ahead.
All right, awesome. Okay, so I'm going to have you, we're going to practice the log roll method, and that's going to keep your whole body in alignment, your upper body in alignment, and we're going to protect that chest by hugging your sternal or your heart pillow.
Okay.
I would turn it sideways this way because we want to protect those chest muscles. So you can cross your arms like this. Perfect. In one movement, we're going to roll towards me. Uncross your leg for me. And then you're going to roll towards me and we're going to bend those knees. All right.
Okay.
So on the count of 3, I'm going to have you roll towards me. And if you're struggling, I can help you out. I can jump in and help.
And bend my knees at the same time.
And bend your knee. Yeah.
Okay.
Yep. All right. 1, 2, 3. Roll towards me. Perfect. Awesome. Okay. So from here, I'm going to scoot your legs closer to the bed, or to the edge of the bed. Yep. Good job. All right. And then as I help, would you like my help moving your legs down across, or
Yes,
do you think?
please.
Yes, please. Okay, awesome. And as I do that, we're gonna use your shoulder and this arm here. Try not to let it come away from your body and don't put pressure through your hands to push up. Just try to use that shoulder and you're gonna use some of your oblique muscles on this side, but try to maintain, keep squeezing that pillow. Are you ready? On the count of 3. 1, 2, 3. Perfect. Awesome. Nice and slow, go at your own pace. Don't try to rush anything. Again, we want to avoid injury or damage to your incision. Okay. All right. From here, we can let go of this. How are you feeling? Are you dizzy? Are you feeling short of breath? How's your heart?
My chest hurts.
Your chest hurts. We can take a couple deep breaths. We can, just relax here for a minute. While I get your shirt, we're going to work on upper body dressing, maintaining sternal precautions.
Okay.
Forgot to grab this earlier. Hey, moving the tube, bud.
No coffee after surgery.
Yeah, you can have coffee, but remember you were just moved out here, so make sure we can get you we'll do some environmental modifications. We can have your table pulled closer to you so that you can reach. Yeah, that's okay. All right, so from here we are going to place your shirt tag down, so kind of upside down in your lap, and you can use your hands here. We're gonna you'll just kind of use your fingers to. And we're gonna use your fingers to reach up. Okay, just to place it. So now first we're going to thread your left arm through the, and try to make sure to keep your elbows in. Don't reach up over your head. So you're gonna bend your head down as you thread this up. Yep, with this hand.
Okay.
This is your neck hole right here.
Yep.
Yep, and so you're gonna pull it up. Good, and then you're gonna dip your head down into your neck hole. You got it. Very good. Awesome. From here, you can use this hand to pull it down, and we're gonna get your other arm in.
Okay.
All right, so this is a little bit tricky because you're a big guy and we aren't supposed to reach behind, so just do your best to pull it down. You can use both hands to pull your shirt down. Awesome. If you have an assistant at home, maybe you're not supposed to reach behind. I know. So, do you have anybody at home to, hey, sorry. Do you have anybody at home to help you?
I do, thank
You
goodness.
do, awesome. So they can be on standby to help you adjust your clothing. That way you're preventing wrinkles or anything. Okay.
Thank you.
Awesome.
Perfect.
On your video, it didn't show how to take shirts off. Is it, because I know a lot of guys like do this sort of stuff. Is it just kind of the same?
Yeah, I would say just doing the same thing, just in reverse order. And then
Okay.
also, I didn't show it in the video because I didn't have one. But a lot of times with like following like a CABG procedure, you can always just recommend like wearing button ups or like looser clothes just because it's a lot easier to do.
Awesome.
But yeah,
Okay.
that's good.
Perfect.
All right.
And then, what is that? That's about it. All 3, right?
And then last, I just have a case study.
You're good.
So he's good.
All right.
Thank you.
Cool. Thank you. I
Thank
appreciate
you.
that, lovely assistant.
Good day.
So just a case study similar to the one I showed you, and then just some questions, and then that'll be it. So let me see if I can share my screen just so I don't have to read it.
Thanks, babe.
Yeah.
B. Okay, maybe not. Don't know how to share on here.
Do you want to try to email it to me and I can try to pull it up on the side maybe?
I think I might have gotten it. Let's see. Aha.
Oh, yeah.
Oh boy. Can you see like my entire screen here?
Yes. Sorry.
Okay. No, that's fine. Just want to make sure I had like the right thing open.
Yeah.
Okay. So can you read that, or do you want me to make it a little
Yeah.
bigger?
I think it's okay. Oh, that's good. Thank you. My 40-year-old eyes here. I like the name Eloise. Okay. Okay, CABG procedure 7 days ago. Patient rehab center. Foster precautions. You ask her about her cerebral precautions. She doesn't remember. Okay. Eloise is experiencing pain in her chest and concerned about her ability to complete daily activities. Okay. During eval, Eloise demonstrated difficulty maintaining precautions, upper body dressing and transfer. 1-story house alone. Enjoys gardening. She wants to get back to. All righty. Sounds good.
Stop sharing. Okay. So what is the first and most important thing to address with Eloise before beginning therapeutic activities?
She needs to be educated, and understanding needs to be confirmed for upper body, or I'm sorry, sternal precautions, I think, during activities after her surgery.
Yeah. And then with that, like you could, depending on like her cognitive level, and then like
Oh,
her
I forgot to tell
understanding.
my husband I have I got visuals too.
There we
Totally
go.
forgot.
Yeah.
But yeah, so
That's
I brought
good.
my visuals because I am a super visual learner also.
Mhm.
So that would help.
Yeah, that's what I was going to suggest. You can always suggest visuals as well. And then how would you address ADLs such as upper body dressing with Eloise?
Same thing that we just demonstrated here. Make sure that she's keeping her arms in her body, like you just suggested, actually, like with using the button-up shirts, or larger button-up shirts would be beneficial. Also, any kind of like reaching aids and things in order to get to her stuff. So, like if her things are in her closet, we could use a grabber. We could, and then make sure if she's reaching for things in her closet to get her shirts using both hands together, I think.
And then kind of just answered the next one, but is
Oh,
there any adaptive equipment you
oh,
would suggest?
fabulous. Awesome. Yeah, we got the reachers for upper body. Wow. I was thinking also like the shoe horns and like sock aids
Mhm.
for to prevent bending too much and pulling too much. Yeah, and twisting or anything.
And then last one, how would you address Eloise's goal of wanting to get back into gardening?
She needs to take care of her body first and foremost. Healing time is different for everybody. If she's maintaining the sternal precautions, not lifting heavy things, and just not doing any strenuous activities, her body's going to heal faster. Take it slow. If you're in pain, back off. But I'm thinking, and depending on her gardening things, she could do more like raised garden things. So anything that is not having her bend or like reach and dig. So if she's doing things with both hands together that is close to her body, it would be easier if she's just walking around watering her plants and things. She can do that with like, a hose. But just making sure that she's maintaining those sternal precautions while doing those activities.
Yeah, perfect. My thought was just like you kind of said, also addressing the pain that she's experiencing. So maybe doing like activities with that, and then you could also do like simulated therapeutic like gardening activities, and like you said, maybe
Awesome.
like a raised like bed or
Mhm.
avoiding like getting down on all fours and bending and stuff.
Awesome.
But yeah, that's all I have.
Very
You did,
cool. And
you
staying
did
on top of
great.
pain meds, especially if she's feeling like it's happening like frequent, like if she forgets her pain meds, so we could do something like medication, like scheduling, or have timers on her phone, or make sure that she's got like a pill case or something, because after my C-section, it was hard for me to stay on top of that. I'm like, and life was a little easier on top of, or when the pain was not brutal.
Yeah, for sure. Could definitely do a medication management activity. Um, do you have any like questions or anything? You did great.
Yeah, thank you so much. I was just curious about like the shirt removal. Um, and then so if so with like the t-shirt that I used with Jason, like if it is up here, is he allowed to like I know that we're not supposed to reach both hands. Is he allowed to like go back with like one hand as long as he's like keeping it close? I mean, it doesn't if he's not like I don't know.
Yeah, I feel like it's kind of
So
hard. That's
just
why I was saying, suggesting more of, they do suggest like the button in the front just so you don't have to reach back, or like
gotcha.
larger shirts because then it just
Awesome.
falls more. I
Yeah.
think the best way would be kind of reaching like in the front and trying to pull it
Okay.
back
Yeah. So keep your
because
arms across your chest and just
yeah,
reach it from the sides, but like, okay.
yeah, because reaching back with
Awesome.
one would still put stress on like one way.
Okay.
So it'd be, yeah, kind of hard, but
Okay.
definitely hard.
Yeah, I know.
Yeah,
Yeah. It's tricky stuff,
perfect.
but awesome.
Great.
Your module was incredible. I was like,
Oh,
this looks
thank
so
you.
professional. Like you rocked it. It was so good.
Oh, thank you. Um, so I have a feedback form that I fill out for
Okay.
you. I don't know if you have one or not.
Mm-mm.
Okay. So once I finish filling it out, then I just send it to you, and then I believe
Perfect.
that's the end of it.
Awesome. Fabulous. I appreciate it. You've been spectacular. I've loved working with you.
Of
Um,
course.
maybe we'll get to work with each other in the future.
Yeah, of course. You're
Cool.
in the
And then
area.
can you send me this video too, just
Yeah.
so that I have it on my side?
Yeah. Let me make sure. Let me
Perfect.
stop recording it and make sure it saves. How do I do that? Yeah, here we go. Stop.